Greenwich Hospital is known for compassion, it's caring, treating patients like they're people, like they're individuals. So taking that into our bariatric surgery program, we really make sure that everyone has an individualized program, that it's not like a cookie cutter.
We are very actively involved in the pre-op and post-operative care of patients who are undergoing bariatric surgery procedures so that we can get the patients better ready for the procedure. We also have support groups both before and after the surgery, so the patients can meet people who have gone through the process and have a system of support both at home and socially, so that they can go through the journey better.
Everybody here is involved from the beginning through their surgery stay, and then for life afterwards as well. So we really want to be invested in you as a person and not just for your surgery. Once you make the decision to have bariatric surgery, or even just to consider learning more about it, what we ask people to do is to register for one of our seminars. And this is a free informational seminar with one of our surgeons. It's a great opportunity to hear about the different types of surgeries we do, pros and cons, risks and benefits. Also, you get a chance to interact and ask questions with the surgeon directly. So that's a really great first step. And from there, we really take people through the process of going to support groups, going to get all their medical clearances.
We have a comprehensive care pre-operatively and a support system that extends post-operatively for the patients, including support groups.
We do have two support groups. One is a pre-op and post-op sort of a mixed support group, which is great. It gives people before surgery the opportunity to meet with people who have already had the surgery, talk about how real life is going to be afterwards. And then we also have a separate support group for people who have already had the surgery. There are some specific issues that they want to talk amongst themselves, find out how other people in their situation have managed. And so we have a buddy program here where if you're somebody who's new and not sure what to expect, we can certainly partner you up with someone who's had the surgery. You can connect with them and chat on your own time about anything that comes up. And then as well, if you're a new person who's just had surgery, you can also partner up with someone who's had surgery multiple years ago and just kind of use them as a buddy and a support system on your own as well.
We get involved with the other specialists, including cardiologists, pulmonologists, psychologists, nutritionists that are available.
We have a pharmacist that comes in to talk about medication changes leading up to surgery, the day of surgery, as well as after surgery when you go home.
The exercise physiologists also play a very important role because they educate the patients before and post-operatively about the kind of exercises that we encourage and recommend that they do so that their recovery is faster.
When you have the surgery, you have all the information for afterwards.
Each member of the team is compassionate and passionate about taking care of these patients. The diet that we recommend is very well structured, and the patients go through a preoperative and a postoperative educational process. We give them initially for a few days liquid diet, which is then advanced to soft diet, and within 2 to 3 weeks after surgery, we can advance them to more solid food. They work closely with us and with the nutritionist, and we advance them depending on the progression that they're making.
We consult with a chef who can prepare meals for you that are perfectly tailored to what your needs are, and they do consult with us to make sure that it's appropriate, nutrient-wise as well.
A lot of patients come to us and they're undecided whether surgery is the right thing for them, and a lot of them are afraid of surgery. And I tell them, listen, the more important thing is improving your quality of life. But very important for the patients to understand that surgery is just one part of the whole process. Not everybody who comes to us will and should have surgery. Our aim is to improve your quality of life and improve your health. And surgery is just one tool in the whole process.